I'm Dr. David Hill, and today we're going to be talking about how to learn the signs of autism. Now, most people at this point have some at least vague idea of what autism spectrum disorders are. Notice I use the plural there. Autism is really a symptom. It describes a way that a certain group of young children behave, but it's not one disease. It's really suggestive of a whole multitude of largely genetic conditions that all cause the same sort of symptom. So what are the symptoms of autism? That's important to know for a couple of reasons. First of all, some of those conditions can be diagnosed and treated, especially if they're caught early. Second of all, we know that children who have autism, even when we don't know the exact cause of the autism, do benefit from early intervention. And so we want to make sure those children get to the right resources as soon as they possibly can. So what would tell you that your child has autism? Well, for that, you got to know what the essential issue is in autism. In autism, a child fails to some extent to develop the idea that other people have thoughts and feelings like they do. That's called a theory of mind. And at its essence, autism is a failure of a theory of mind. So how do you start seeing that? You may start seeing the signs of autism as early as 9 months of age. By 9 months of age, an infant should at least recognize his or her name. So if the infant doesn't seem to recognize his or her name, you're calling him, doesn't look up, he treats it like any other sound in the environment, that can be concerning. Now, it could be a matter of deafness or some other problem. It's not necessarily autism, but it gets your attention. Another thing that the infant should understand at 9 months of age is the word no. Doesn't mean he's always going to do it, right? They may keep doing what they want, but they should at least demonstrate an awareness that no means you're pretty unhappy with what they're doing and would like them to stop. Another thing you'll see by 9 to 12 months of age is that when your infant is confronted with a new situation, it may be a stranger who walks up to say hello to them, they may walk into a place they've never been before, it may just even be a scary toy or a loud noise, that infant will always look to the parent's face, often it's the mother's face, for cues as to how scared to be. So if you keep a close eye on this infant between 9 and 12 months of age, when they're in a challenging situation, you'll see a little glance, usually up at your face. Hey, what's going on? Is this okay? Should I be scared? Should I be worried? And they should respond to your facial expression. If you look scared, they're going to crank up. And if you smile at them and speak to them in a gentle voice, they're going to calm down. Infants who do not demonstrate that sort of behavior lack what we call joint attention, and that can be a concerning sign of autism. Now, between 12 and 15 to 18 months of age, you're going to see some other behaviors. Infants are going to start, or these toddlers are going to start to point to show you what they're interested in or what they want. Why? Because they know you are a person who think and feel, and they want to share what they're observing with you. So if your infant doesn't, or if your toddler doesn't bring you things to show you, doesn't try to direct your attention to what they're doing, doesn't try to point and show you what they're interested in, that can be very concerning. Delay in language development is concerning. We like a 15-month-old to say mama, dada, and a few more words. At 18 months, we like them to have a good 10 words or so that they can use. So any delay in language development can be concerning. Children who use toys as objects by 18 months of age get our attention. A child should roll a car, hug or feed a baby doll, hug a teddy bear. They shouldn't use them like any other random object, simply banging them together or lining them up and messing them up and doing it again. Although boys may line their cars up, they're also going to roll them and make vrooming sounds and treat them as they are. It's this representation of the object being something else, the use of imagination, that also suggests a theory of mind. Now, there are several other hallmarks to look for autism. I've covered some of the biggest, easiest ones to see, but you'll find dozens of internet web resources to find other ways that you can look for autism. So, talking about signs to check for autism early, I'm Dr. David Hill.